Now, believe it or not, a lot of children get injured at home, even under parental supervision. It's just one of those things that are unavoidable, and there's a lot of parental guilt around it. But just know that you're not alone. We see this a lot in emergency departments. Now, a lot of these injuries are unavoidable, but some of them are avoidable, and there are some things that you can do at home to just be aware of them. So I want to go through some of the most common hazards at home and some of the things that you can do. Falls, I would say, is something that's really common in terms of injuries at home. So if we're talking about babies, I often see babies who have fallen off the change table by accident, for example, or fallen off the bed or a couch. Sometimes we forget that babies can move and roll, but as soon as they can roll, they're at risk of falling. So making sure that you're supervising babies on high up surfaces is really important. With older children, jumping off furniture, jumping off trampolines are the common culprits for injuries at home. So again, making sure you're supervising where possible, but as we all know, kids of this age can jump off anything at any time in a split second. So the next hazard to speak about is burns. During lockdown, we saw rates of burns go through the roof. And again, these mostly happened at home with a parent around. Most common types of burns are hot fluids spilt on a child by a parent by accident, or a child lifting up onto a table, for example, and pulling down a hot cup of tea or pulling a pot off a stove. Hot bath water as well can cause burns in children. Now, burns are really scary and really painful, but there's one thing that you can do as a parent at home that is crucial for burn healing, and that is burn first aid, running the burn under cold water for 20 minutes. So you want to remove the clothing where the burn has occurred and run the area under cold running water for as long as you can until help arrives, ideally 20 minutes. So this might be popping the child in the bath, popping them in the shower and just hosing them down over the area of the burn for at least 20 minutes. Now, the next thing that we see a lot of is cuts. And this often happens with head strikes, thanks to coffee tables, bookshelves, walls. We see it all the time. And often we end up having to do a glue or a bit of stitching of the area that's being cut. This is really common. And I know parents get very worried when this happens, but it actually happens a lot. The main thing with any bleeding is to apply as much pressure as possible to the area until you can seek some help. The next hazard that happens less commonly, but is very important to know about, is drowning. Now, a child only needs a very small amount of water to drown, so even in a very shallow bathtub, children can drown. Pools are definitely the most dangerous in terms of household hazards, and the most important thing is that these children need to be supervised when near any water. So even with a bathtub, the common scenario is a parent goes to the next room to grab something and comes back and the child is blue in the bath. Really important to not leave a child unattended in a bath, because even a few seconds can be all it takes. The next important hazard is kids swallowing things. Kids will put anything in their mouth that they can get their hands on. So we see anything from coins to bugs to balloons, anything being swallowed by children. Now, most of these things come out the other side, and apart from being a bit stressful, it's actually really harmless. But the biggest concern that we worry about is button batteries or pairs of small magnets. Button batteries can erode the inside of the esophagus or the gut, and it can be life-threatening. So it is really crucial that if you have suspected your child has swallowed a button battery, to go straight to emergency, because they will need an urgent x-ray. And the best way to avoid this is to make sure that you're checking for all remotes, toys, watches, anything that could have button batteries in them, and making sure they're out of your child's reach. If it's not there, they're not going to be able to swallow it. The other things that kids swallow are all sorts of fluids and medication. Grandparents' medications is a big one that we see in emergency departments, or dishwashing and cleaning fluids. Even essential oils. If kids can get their hands on eucalyptus oil, they will swallow it. Believe it or not, a lot of these can be lethal. So the most important thing is, again, keep it out of reach. If they can't get to it, they can't swallow it. And I'd also keep it out of reach of older children, because often we see the very helpful older child try to give their younger siblings some medication and they end up in hospital. So making sure that anything that's potentially harmful is out of reach of little hands. If you are concerned that your child has swallowed something poisonous, the Poisons Hotline is really important to call. They will give you advice on what you need to do and whether you need to be concerned. But of course, if you are worried about how your child looks after swallowing something potentially dangerous, always head straight to emergency. The other main hazard I want to touch on at home is road safety. Believe it or not, children get run over in their own driveways by parents by accident. It's devastating when this happens because there's a lot of parental guilt. Now, since having reverse cameras on cars, this has dramatically reduced, but it does still happen. So just being really careful when coming in and out of driveways in your home when there are young children around. Also, just riding around without helmets is a huge safety issue. So making sure that you're teaching your children about riding with helmets and just general road safety tips can be really helpful. Now, some of these things may seem really trivial, but a lot of these injuries are what bring children into hospital. So trying out a few of these things and being prepared might just save you a trip.